Hello, this is Chad Moses, physical therapist with UNC Healthcare and Cary Orthopaedics. In today's patient education series, we'll be discussing myofascial cupping. Myofascial cupping is an alternative or traditional medicine that involves the application of cups onto the skin. Like some of our other modalities, such as dry needling or instrument-assisted soft tissue mobilization, cupping dates back to 1500 BC, where it was widely used by Egyptian, Greek, and Chinese civilizations. In Chinese culture, they would take cups and place them over the most painful areas or acupuncture points. The purpose of using myofascial cups is to ease soft tissue restriction by facilitating its release and mobilization, and this is done through the vacuum effect or suction on the targeted area. So the types of cups. So in Western medicine, the cups are typically made from glass, a hard plastic, or a silicone base. The sizes and the shapes of the cups depend on the area that you're targeting. You can use one cup or several cups. This is usually practitioner preference, but as with most treatments, less is always more. So it always start conservative and then work your way up from there. So as far as the intensity of the suction, it should be minimal to moderate, but within the patient's comfort level. And most treatments last anywhere from 2 minutes to 15 minutes in one specific region. So cupping techniques. So there's static and dynamic. So static or dry cupping, the cup is placed in one position and not moved for the duration of the treatment. With dynamic or gliding, you use some type of emollient such as cocoa butter or oil, and the cup moves freely over the targeted area while maintaining suction. Treatments can also be passive, where there's no need for the patient to move, or active. You can work that patient through specific ranges of motion or exercises while maintaining the suction of the cup in that targeted area. Based on our current research and understanding of how cupping works, it's based on 3 principles: fluid dynamics, mechanical effect, and neurological. With fluid dynamics, you can expect to see certain chemical changes occur in the targeted area due to fluid motion. Cupping creates an area of ischemia due to the lifting and suction effects. Localized vasodilation occurs to address this ischemia. Therefore, increase in blood flow to the area helps to desensitize the area and help with pain relief. The mechanical effects of cupping involves decompression and tissue extensibility. We have the decompression of the tissue due to the lifting and gliding effects. This helps with the tissue's ability to glide over other surrounding tissues, compared to the compressive forces of traditional deep tissue massage. And finally, the neurological aspect. The irritability of nerves and trigger points can be desensitized with cupping. This is a neurophysiological response to pain modification. We can tap into our body's ability to facilitate and release neurotransmitters to help control and minimize pain. As always, thanks for watching and enjoy the demonstration. After a myofascial cupping session, you may have increased redness in the area. This is temporary and occurs due to vasodilation. You may also experience marks or bruising. As with instrument-assisted soft tissue mobilization, you can rupture small capillaries and some of the blood vessels closest to the skin. These will go away in 1 to 3 weeks. More bruising does not mean a better treatment. Ideally, we want to create the least amount possible.